My name is Dr. Marc Beaghler. I work in Ventura with my partner Seyed Khoddami, and we're at San Buenaventura Urology. And today we're going to discuss InterStim therapy for urgency and urinary frequency and incontinence. Overactive bladder is a very common problem. We see it in many patients. It affects millions of patients worldwide, and it can cause urinary urgency, urinary frequency, and even urinary incontinence or leakage of urine. We try to do conservative treatments prior to doing InterStim therapy, for example. And conservative treatments involve exercises for the pelvic floor, changes in diet and fluid intake, and also we do physical therapy. If doing simple measures doesn't work, then the next step in treatment is medication. And there are multiple medications that are available and that are used. And oftentimes, before the patient even sees us, they've gone through several trials of medication. Problem with medications can be side effects. In addition, they're not always as effective as we hope they are. So in patients that fail medication therapy, then we will reevaluate the patient. After this evaluation, we will discuss other treatment options that are available to the patient, and oftentimes at this particular juncture where they have been tried on medications and failed, we will discuss InterStim therapy. Neuromodulation is a procedure that has been developed and has had almost 20 years of experience. It involves the placement of a small battery and a small lead that goes to the nerve roots that in this particular instance are involved in urination. And what neuromodulation does is it calms down the message between the nerve and the bladder so that the bladder doesn't feel like it has to empty it all of the time. The implantable InterStim system provides mild electrical stimulation and helps normalize the communication between the bladder and the nervous system. There's a very simple basic test that we can do that does not involve surgery, it does not involve any incisions. It's a procedure that can be done in the office or can be done as an outpatient. And in this test, we place a small, thin electrode down to the nerve root that goes to the bladder. And then we will test the patient to see if they're a good candidate for InterStim therapy. We'll sit down, we'll discuss with you whether you're a good candidate to move on to the next step, which may be an InterStim implant. In many patients, they've had remarkable improvement in their urinary symptoms. This includes decreasing urinary frequency, episodes of urinary incontinence, and trips to the bathroom at night. In some patients, this can be an absolute life-changing experience where they can go from voiding every 30 minutes or having to get to the bathroom or find a bathroom every 30 minutes to having a normal urinary voiding pattern.